Good morning, everyone. My name is Mariana Osoria, and I am the co-chair of the Puerto Rican Agenda. I'd like to welcome you all here on this really lovely sunny day, not too warm, but certainly sunny for day 2 of the Health Summit. Hopefully it'll get a little warmer in the day. I want to first share with you that we truly apologize for the issues that transpired yesterday that caused sessions to be canceled and postponed. Unfortunately, many of you know that the event was hacked and it caused quite a bit of havoc for presenters and the health committee. I also want to thank the health committee for their efforts working through the night, actually, to ensure that today's events are secure and that we continue with the important work of the health committee. We know, of course, that the event, even with these ramped up measures, there could still be challenges. So in the event that there are concerns that you see during a session, we would ask you to log off immediately in order to protect yourself and your devices and the event. So just want to give you all that heads up. And again, our apology that occurred. We're certainly learning a lot through this session. Again, I want to welcome you all. I want to start by sharing my grief around the issues that are occurring in our communities and honor the lives of George Floyd, Dante Wright, and from right here in Chicago, Adam Toledo. We know that there are many lives that have been lost too soon and unjustly. It is all of our work to move against structural racism and support our communities to ensure access and investment. Your participation in today's events demonstrates to me and hopefully to each other the importance that you place on one of those needed areas of investment, and that is health and well-being of Puerto Ricans and Latinos in our communities. You all come from different walks of life. Some of you are professors, some students, community-based organizational leaders, providers, doctors, lawyers, housing experts, and many, many other sectors. It is that collaborative work, that collaboration, and working across sectors that we are going to have the greatest impact on the health and wellness of our community. We understand that health has a lot more to do than simply an annual well visit, immunizations, or a diagnosis. It means access to care, it means access to education, it means access to a number of opportunities and environments that we call the social determinants of health. The hope and efforts of the Puerto Rican Agenda's Health Committee in partnership with the Agenda is that together we can come up with key themes, learning, ideas, and action steps that are going to support our community well into the future to be able to realize what we all hope is self-actualization, self-reliance, and self-determination of our people. I'm going to echo my co-chair Jessie Fuentes' words from the press conference on Tuesday to remind us and remember that we must look at the work that we're doing through the lens of recognizing the history of inequality, a history of structural racism based in colonization and oppression. We must work ahead to ensure that the work that we do really impacts and goes against that said decolonization. I know that each of you in your communities are doing work, giving back, volunteering, providing insight and input. Continue to do that. But also consider how together, with intention, we can have greater impact, deeper impact, and long-lasting impact to support our children and families to meet all of our goals in life, including those health goals. With that, I would like to invite you to enjoy the rest of the day and to think about how what you learned today matters and how you will implement it into the future. And speaking of impacts and a commitment to community, I would now like to introduce you to the Honorable 26th Ward Alderman, Roberto Maldonado. Alderman Maldonado has an extensive background in public service, as many of you know. He is a committed and ardent advocate for the residents in his community and city. And in particular, he is a keeper and protector of the Puerto Rican community in Chicago. He's been alderman of the 26th Ward since 2009 and in public office before that, so quite a trajectory. In 2019, as a result of his commitment, a resolution was passed that will convert the longstanding Paseo Boricua, which we all know and love, into a broader and richer opportunity that will afford not only cultural affirmation, but economic opportunity to the area which we now call Puerto Rico Town. The Puerto Rican Agenda is currently working to support legislation at the state level in both the House and Senate that will further these efforts. This vision will support our community and see that same community grow and thrive. So without further ado, I want to thank Alderman Maldonado for your continued work in the community, and thank you for being with us today. Welcome.
Thank you so very much, Mariana, for that very, very kind introduction. And I want to thank the Puerto Rican Agenda, especially its Health Committee, for putting together this summit, just like the Puerto Rican Agenda put a housing summit 2.5 years ago. I want to this is a very I want to say that this is a very timely summit to have around the issue of health. Um, it is so it is mind-boggling to think about the the same reality. It's like we have not moved in time from 30 plus years ago when we were claiming and screaming to through our lungs of our health disparities that we suffer, not only in the Latino community, but in other communities of color. And it's so shameful, I must say, to us as a society that must still we still have to say that the same health disparities that I learned more than 30 years ago, that the Latino community, especially the Puerto Rican community, we were suffering back then, we're still in the same position. It's like that. It's like time have not affected us, and sadly, the very same health issues and public health issues of 30 plus years ago, as a result, primarily because of the lack of health disparity, because of the health disparities, are the same today. Um, Hypertension among the Puerto Rican community, asthma, and diabetes type 2. Those are the three primary health issues that we are going through and suffering of in the Puerto Rican community. And today we have added two other ones: obesity, and we also have added the increment of cases and of dementia in among the Puerto Rican community. And so there is so much work to do, and I hope that 30 years from today, we will not find ourselves in the same stationary stage in which we are today, in which we have sadly to say that no improvement whatsoever have happened, have occurred in terms of the closing the gap of our health disparity. The movement and the organizing denouncement of this reality has increased, but we have not seen the change. So I hope that that given the political uh, conditions that we are experiencing around the racial equity matters that we are talking so much about, that real substantial changes will occur in the next following months and years to come. So again, I want to thank all the participants, all the presenters that we're going to hear from here today for your time and dedication to come before our Puerto Rican community and speak about your knowledge, your expertise, and the changes that you are really trying to affect um, in our community. But also, I want to thank all the participants that will be listening to this conference today. And I hope that this will be another call to action that will bring about the real action that we need. Thank you so very much, and I hope that you have a wonderful summit day. Thank you.
You're on mute, Nelly.
Sorry. I do this several times. You would think I would unmute myself. Well, thank you, Mariana and Alderman Roberto Maldonado for your leadership, friendship, and support. I'm Nelida de León, and I'm the Puerto Rican Agenda Health Committee co-chair to Dr. Giacello. For those of you that don't know me, I'm a proud product of the Chicago Humboldt Park community, and I'm still here. Grew up in a mom and pop store, graduated from DePaul, married an ex-seminary in Vincentian, and raised my son and twin daughters in Humboldt Park. I started my career in the private sector working for Unisys, MCI, and Polaroid Corporation, and then began my career in state government as the state procurement officer managing a $6.5 billion portfolio, and later was appointed as the Assistant Secretary of Programs at the Illinois Department of Human Services, managing over 500 programs and 13,000 employees. After state government, I worked on a federal program moving families from public housing to private housing that took me from the southern tip of Illinois to Mobile, Alabama. And I'm currently working for Global Recruiters Network, a top executive search firm in Chicago. First, we want to thank the Planning Committee, our fearless leader, Dr. Giacello, Susana Gonzalez, Lisa Sanchez Johnson, Cesar Rolón, Marta Celda, Lisa Pontesoto, Mónica Rodríguez, Natalie Suarez, Jacqueline Soto, Dr. Marina de Rios, Hilda Frontane, Bella Lazarski, Maya Estrella, Priscilla Cepeda, Xavier Nogueras, Jesse Fuentes, Mariana Osoria, and Tatiana Villalobos, who all took time to put this together in less than 2 months. We also want to thank our sponsors, who are all listed on our websites on all social platforms, and I listed them in the background. To name a few, thank you, Puerto Rico Property, National Institute of Health, the All of Us program, Islet Home Health Care Services, Blue Cross Blue Shield, Cabrera Capital Markets, Cigna, Humboldt Park Health, Walmart of Puerto Rico, Pilsen Wellness Center, Rincon Family Services, UIC Institute for Minority Health Research, the National Conference of Puerto Rican Women, National Association of Hispanic Nurses, Vida Sida, Rush, Illinois Unidos, the Puerto Rican Cultural Center, NBC, and many more. Now that we got all that out of the way, welcome to day 2 of the Puerto Rican Health Summit. Please review your agenda and a quick recap of yesterday, day 1. We had an excellent morning session, and the afternoon session has been postponed, like Mariana said. Yesterday, we heard from many of our subject matter experts, Dr. Giacello, Dr. Avila Santa, Dr. Zambrana, Dr. Aguirre Molina, on the critical health issues that affect the Puerto Rican Latinx communities in Chicago, the US, and Puerto Rico. And many touched on health disparities in the brown and Black communities. I don't know about you, but after listening to each presenter yesterday, there is so much more to do. We need to take action against structural racism, as Dr. Zambrana and Dr. Molina mentioned. We need to bring about change. As our state of Illinois Lieutenant Governor, Juliana Stratton, said so powerfully yesterday morning, we need to focus on justice in all areas that impact health to improve the quality of life for all. So with that said, I hope you enjoyed day 2 of the Puerto Rican Health Summit. And here is a message to all of us from our US State Senator, Dick Durbin. It should be coming up shortly.
I want to commend the Puerto Rican Agenda for organizing this health summit. Thanks also to all the people attending, the organizations supporting this important gathering. Puerto Ricans and other Black and Brown Americans have suffered disproportionately in this COVID-19 pandemic. More COVID infections, hospitalizations, and sadly, a greater death rate. big economic hardships as a result of COVID lockdowns. This summit couldn't come at a better time. We remember the devastation when Hurricane Maria slammed Puerto Rico. Back then, America had a president who thought the solution was to sell the island or trade it for Greenland. Fortunately, the American people had a better idea. They traded up for a new president. On his first full day in office, Biden signed an executive order creating the COVID-19 Health Equity Task Force to help lead a government-wide effort to identify, eliminate health and social disparities that left communities of color so vulnerable. Passing President Biden's American Rescue Plan was job one for this new Congress. We did it. We're getting stimulus checks in families' pockets, PPP loans to small businesses, COVID vaccines into people's arms, regardless of their insurance coverage or their immigration status. The American Rescue Plan also includes money for health insurance premiums and COBRA coverage and enhanced SNAP benefits and expands the federal child tax credit to Puerto Rico. Our next big challenge in Washington is passing President Biden's American Jobs Act, the biggest investment in American infrastructure and jobs in more than 50 years, and we need it. It will address climate change. It'll create good jobs and industries of the future right here in America at home. It will allow us to modernize Puerto Rico's crumbling infrastructure so the island can create good jobs and withstand climate-related catastrophe. I'm committed to see it through. The Senate and I want to see it signed by the President. Thanks again to the Puerto Rican Agenda. You can count on me to be your partner.
And thank you for listening in to the first session today.